everyone. Happy Tuesday. Welcome to a Tuesday evening at my house. So you may hear some background noise. We are getting ready for bedtime here, so just be patient with us. I'm actually really excited for tonight's live, and I'm really excited for tonight's guest, Dr. Justin Dubin, who I saw just join. So let's see. There we go. Hey, how are you?
Good. How are you?
Good,
Happy
good.
Tuesday.
I know. I was just telling the audience that it's like kind of wild here at my house right now. So if there's background noise, I apologize in advance. But thank you so much for joining me tonight. I'm really looking forward to this.
No, thanks for having me. I think it's a really important topic, and I'm really happy to talk about it. It's something that we really, obviously you focus on the female, but you always focus on the couple as a whole.
Sure.
And a lot of the things that we're going to be discussing today is that big picture stuff where the role of fertility with men and how testosterone specifically, as we'll discuss, can play a role in that in a good or bad way.
Yeah, I love that teaser intro for the audience. So we're going to go ahead and jump right in. Before we actually get started, though, I want people to get to know you. So guys, tonight's talk, for those who are just joining us, is on testosterone therapy. Something I noticed when I moved out from California is the frequency with which men are typically seen on testosterone here is way, way, way higher than anything I saw in California. And because of the relationship with fertility, I thought it was super important to bring on tonight's guest. So Dr. Dubin, if you could just give us a few minutes of intro and let us know about you, that would be awesome.
For sure. So my name is Justin Dubin. I'm a urologist. I specialize in men's health, male infertility, andrology, sexual medicine. Originally from New Jersey. I did my residency. I went to Johns Hopkins undergrad, did my medical school back in Rutgers, New Jersey, did my residency down south here in South Florida at University of Miami. I wanted to specialize in men's health, male infertility, sexual medicine. So I ended up going to Northwestern in Chicago for a year for fellowship training. And I loved Florida so much, I came back, and now I'm practicing.
You were done with the cold.
Right?
Yeah.
So listen, you're back.
Because you're very, very humble, but I just want to take a quick second. So when a urologist does their training, how many years of residency is it?
So it can be 5 or 6. My program was 5, and then the extra fellowship year was 1 year.
And
so,
I want to highlight that fellowship year. I think it takes, when you've put so many years into schooling and med school loan debt and all this kind of stuff, to have enough of an interest to subspecialize and take that extra year, requiring a move across the country, requiring a move to the cold, etc. And we just got Dr. Dubin is the best urologist I know. So there you go.
Thank you.
The man of the hour. So I wanted to highlight that, it is important when, men, first of all, they tend to access healthcare less than women in general. And number two, when they access healthcare, a lot of times they don't know who to look for or what to ask. And so I think this piece is just really important, and I wanted to highlight that. So you've been back in South Florida now for how long?
I have my practice is in Broward County. I'm at Memorial Healthcare Systems. So I have an office in Aventura, Pembroke Pines, Hollywood, and Boca Raton. I've been practicing now for about 1.5 years down here, and it's been a really wonderful experience. Treating. I feel
like after like year 3, you become a local in this area. I feel like there's so many of us that are transplants from other places. All right, so we're gonna get right to it. The accolades just keep coming. I'm so excited to have you on tonight. So let's start with just kind of a really simple question, which is, why would a guy be put on TRT? And for those who don't know, if you could tell us what TRT is and kind of what it entails.
So TRT is short for testosterone replacement therapy. And, testosterone has become a very, very popular hot topic, especially in the last probably five years or so. With a lot of direct-to-consumer places coming up and people being treated for low testosterone. Now, understanding the prevalence of low testosterone and the signs and symptoms of low testosterone is also important. And believe it or not, we're starting to see increase in low testosterone rates among
Oh,
younger people. We think about 20% of men under the age of 40 have low testosterone, 30% in
wait,
their
did you
60s.
just say 20% under the age of 40?
Some studies have suggested as high
Wow.
as 20% in their 40s and 60s, 30% in their 70s, 50% in their 80s. And
Wow.
the signs and symptoms of low testosterone are things like low energy, low libido, erectile dysfunction, weight gain, muscle loss. And as men develop, we're getting less active. More people are having diabetes. More people are obese, and these are risk factors for having low testosterone. Now, the problem with having low testosterone is it's something that we do want to treat if you have it, because having low testosterone puts you at higher risk for diabetes or poorly controlled diabetes, high blood pressure or poorly controlled blood pressure, heart attack, stroke, erectile dysfunction, all the bone health issues. So there's a lot of things that we do want to treat, but the problem inherently becomes how do we treat it?
Mm-hmm.
And there's a lot of different options for testosterone replacement therapy, but the most common one is something like injections, testosterone cypionate, or gels, or things called Testapel, which are pellets that you can put in every few months. Now the problem is when you're taking real testosterone to supplement your low testosterone, you are signaling to your brain that you have made enough testosterone in your body. And normally that's okay. But the main source for men of testosterone is your testicles. And if the testicles are not getting a signal to your brain, and those signals, I'm going to break it down a little bit more scientifically, is LH and FSH. And I'm sure a lot of your patients are familiar with those hormones. So LH is luteinizing hormone, and that's the hormone your brain makes, and it tells your testicles to make testosterone. FSH is follicle stimulating hormone, and that is the hormone your brain makes, tells your testicles to make sperm. Now, typically, if your whole cycle is working normally, you're going to be pumping those hormones into your testicle, and they're going to be creating sperm and creating testosterone. But when you are taking exogenous testosterone, your brain is saying, we've made enough testosterone, we're going to shut down that pathway. So LH and FSH, the one that makes testosterone in your signals your testicles to make testosterone, and the hormone that signals your testicles to make sperm, both cut off. So it can actually cause infertility.
So it's like a male contraceptive or a male birth control, right?
Yes.
I wanna pause there because I think there's a couple takeaways that were actually new concepts for me. So
Sure.
number one, just so people understand, I think that probably the most common presenting complaint, at least what I have heard from my guys, is the low libido, low energy, just kind of that fatigue, sluggish type symptom. Number two is that there's many different ways to treat it. The most common of which is actually just giving testosterone, so giving the hormone that you're not making.
Correct.
And then the third, which I think is the big takeaway, is that it shuts off the internal production of testosterone and sperm. So I think there's like those three key points. And I actually did not know that if you have low testosterone, that there could actually be general health implications. So I think that is a really important bridge, that it's important that we are looking for it, that we are assessing it. I always joke that male fertility is about 10, 15 years behind female infertility, just in terms of
Absolutely.
what we know. And so I think that that's super helpful, and I think it's really important. And it's great that we're looking for it and that we're treating it. It's just now we have to factor in the fertility piece and people that are building their family. So my follow-up question to the TRT, or testosterone replacement therapy, is what if you're trying to get pregnant? What if you're trying to build your family? Can you be on testosterone?
Well, there's one final important aspect that and I know, but most people don't know, is having low T is also a problem for fertility, because your testicles actually need testosterone and good amounts of testosterone to adequately create sperm. So you're almost in this conundrum where you're saying, well, I need to have testosterone in my testicle, but I can't take the exogenous testosterone. What am I going to do? And when we're treating these kinds of men, they're all are alternative medications. And we'll get into those, Clomid, HCG. But to answer your question, in general, the most important thing I think we should highlight, like you said, is especially in South Florida, taking testosterone causes infertility. In fact, we know about 65% of men with normal sperm become what we call azoospermic or sterile after only about 4 months of taking testosterone. And
Wow.
that's important
Yeah.
to know. And, when I see guys all the time who, are on T and they were never informed of these things before, and they've been trying to have a family, as you've seen, for a year or 2 years, and no one had informed them of
Yeah.
these problems. And there's several options to handle this situation. But the good news,
Go
go
ahead.
ahead,
Go
I
ahead.
apologize. So the good news is most of the time, if you stop testosterone, you can recover
So
your sperm. The data
that was
shows,
actually going to be my
right,
question is there ever a point where that, so just for those who don't know, azospermic is complete lack of
right.
sperm. So zero sperm in the ejaculate or sterile, as he said. Is there ever a point where that sterility becomes irreversible, where you can't
It's a
change it?
great question, and I'm going to answer it in kind of a long way
Okay.
because so we know that most people, when you stop testosterone, about 90% of patients who had sperm in their ejaculate before will have a return of sperm to their ejaculate at about 1 year.
And
At two
wait, what was
years,
that percentage? Okay,
90%. So most people do
90%.
recover.
Okay. So
At,
most
yeah,
people within a year will go back to their baseline parameters.
correct.
Okay.
At 2 years, 96% recover.
Okay.
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 So
So those
most
are good
people do recover.
stats.
But here's the problem. The wording, right? I said return of sperm to your ejaculate. That doesn't mean that it's a lot of sperm necessarily. In fact, we know about most people have return of sperm to their ejaculate only get to about 85% at best of what they were before.
Interesting. So there is some sort of injury that we just don't fully
Well, I
understand.
would say that your testicle atrophies. The longer you're on testosterone, your testicle gets lazy. It's just like a muscle in many ways, right? If you're not using that muscle anymore, you're going to lose the strength of the muscle eventually, and it just can't recover. And the other thing that's important is a lot of the guys that you and I see, especially younger couples who have these guys on testosterone, they don't know what their baseline semen parameters were.
Right.
What if they were low?
Right.
And what if 85% of 1 million, which as you and I know is low, is not good?
Right.
So, there's other nuances here that in general, the understanding should be if you really are serious about having kids in the future, you should never start testosterone. I would never put anyone on testosterone that ever wants to have a child at pretty much at any age. For me, the way I treat it is as an end game point once people don't
Are
want to have
done.
kids anymore.
So I think those statistics are pretty staggering, and I just want to highlight those again.
Yeah.
So I think it's important to note. So after 4 months, you said approximately 65% of men become
Yeah.
azospermic or sterile, so
Correct.
no sperm in the ejaculate. Within a year, about 90% of them have some return. But even in best case scenario, we think that return is about 85% of what they were before. So they don't actually go back to their complete baseline. My mind is just blown right now. Like I had no idea that it was that significant. So we see the azospermia, but we always assume, oh, just take them off and then whatnot, et cetera, et cetera. So I have two components to my next question, and you can
Please.
feel free to answer them however you want. So one is the guy that comes in on TRT has already tried to come off, and he's like, I felt awful, like worst feeling in the world, couldn't get out of bed, miserable, et cetera, et cetera. So they're terrified to get off of the T. And then the second component, which segues into the fertility piece, is talking about alternatives to testosterone. So whether they're on it and you're trying to get them off, or whether they want something for that low T, but they want children, so they don't want to start T, what does that look like? So those are my two-part question.
And these are the typical patients both you and I see all the time in South Florida, and more in South Florida than a lot of places, like you said, in California. Chicago, I didn't see close to as amount of people as they are here. Must be the weather, must be the beaches.
Beach culture, beach bodies.
Hey, I'm on that South Beach diet. I just don't eat food ever. You gotta be healthy, gotta be skinny. So let's start off, I think, with that first patient you talked about. The guy who comes in, he's been on T, and he has no sperm in his ejaculate. These guys are often, I try to take them off if I can. Now, once again, you have to go back to that idea of the testicle being almost a muscle. And the longer you're on testosterone, the harder it is to recover, if at all. And sometimes you have a recovery of your sperm, but you're more, we call it a burned out testicle, where you're just not able to get to the testosterone levels you want. Now, ideally, I would stop these medications, testosterone, and I would put them on the alternatives, a combination of usually Clomid and HCG, which you are very familiar with. And to kind of bring the alternatives, I'll quickly explain what they are. So Clomid is clomiphene citrate. There's also N-clomiphene, which is a newer isomer of it, but we'll just start with Clomid. Basically, it's a selective estrogen receptor modifier. What it does is it basically signals to your brain and it says, okay, we need to make more FSH and LH. Those two things, the FSH, which makes sperm, LH, which tells your testicle to make testosterone. And it's tricking your brain to produce more of those hormones, so it really kickstarts your testicle to do more work and create more sperm and create more testosterone. And that's usually what I start with if a patient comes in with low testosterone, never was on testosterone before, and we need to increase their testosterone levels in hope of also potentially improving their fertility.
Got it.
The second option is HCG, human gonadotropin, big word, that's why we call it HCG. And for men, it's very interesting because this hormone, we often think of, it's like the pregnancy test, right? Like that's how we, when you pee on a thing, that's the hormone that's in the urine that women test for their pregnancy. But men can actually also have this, and it can also react a different way. So the hormone itself is structured very similarly to LH, that luteinizing hormone. So when you inject it into your body, and this one is an injection, Clomid is an oral medication. When you inject this into your body, the receptors on your testicle read it as LH. So you're pretty much giving yourself more LH, which is going to stimulate your testicle to create more testosterone and also hopefully improve your fertility as well. And in that patient who comes off of testosterone, I usually give them the full go. I give them HCG, 3 injections a week with either a daily Clomid, usually daily Clomid, half 25 milligrams, HCG usually 2,000 units 3 times a week. So, I'm giving them everything they can. Now, that doesn't necessarily mean they're going to feel great. Now, I have guys who, are on this, they have recovery of their sperm, but they still feel like crap because their testosterone levels are not good. In these situations, and this is something you often see with patients who come in, they're either on testosterone with HCG or they're on testosterone with Clomid in hopes of preserving their fertility before it's gone.
Gotcha.
Now, I will say that the data is stronger for HCG with testosterone than I think for Clomid. I personally don't really feel like Clomid with testosterone works as much. I feel like the the testosterone is just kind of overwhelming the signals to your brain. But the HCG is taking a separate pathway because you're also injecting that. And there is data suggesting that it can preserve your fertility. But I do warn, it's not for everyone. I have put plenty of guys on this and they've lost the sperm that they had. After, going on the pathway, they felt like crap. They felt better on the T and HCG because they were finally getting that exogenous testosterone again, but their sperm disappeared and we started back from scratch. So I try really not to do that if I don't have to.
Gotcha. So what I'm hearing from you is, ideally, patient who's never been on T, Clomid would be that first line therapy. It's a pill and it promotes your own internal hormones to then stimulate the testicle, versus HCG, which is an external hormone and stimulates the testicle directly. So it bypasses that brain and gives your testicle the stimulation directly. Got it. And so for guys who are, I'm going to do the TRT and I'll add in the HCG and I'll be fine, caution, it may not be for everyone. Can you just talk briefly about anastrozole? Because that was another one that I've seen used by some urologists in California. I have not seen it used very much here at all.
So anastrozole is a medication where it's an aromatase inhibitor. Basically, testosterone in the peripheral of your body, mostly in your fat cells, gets actually converted to estrogen. And so what this medication does is it basically stops the conversion of estrogen from testosterone. And a lot of people back 5, 10 years ago, anytime someone was on testosterone, they would give them this because they thought estrogen was bad. Men were manly men. Estrogen's a woman's hormone. We can't have it. And we know that that's actually not the case. Now, I don't really like to give estrogen for testosterone replacement therapy, but I'm going to go back to your infertility part. But I think it's important to understand why. Now, because estrogen is important, we found out why. One, it's important for your libido. So men need estrogen for their libido. It's also important for bone health. So, I try not to give estrogen,
Astrozole.
anastrozole, unless I have to, unless there's like a true, very high estrogen
Gotcha.
level. Now, when we're talking about fertility, I actually have started giving it to some patients.
Okay.
There is some literature out there, and we're not 100% sure on the pharmacology or the physiology of why this works, but there is some data suggesting that in guys with lower sperm counts, giving them, an aromatase inhibitor like an anastrozole can potentially improve their fertility and improve their semen parameters. Now, that, when we're talking about long-term things, Clomid is something where we talked about. You want to have normal testosterone levels. Testosterone, you want to have normal testosterone levels. It's important. So those are medications I'm either keeping you on the long run, right? Like Clomid, I'll keep you on unless you really feel no better or you don't want to take it. But I will keep you on it until you achieve your fertility goals. And then we can always go to testosterone. Anastrozole, though, because of those side effects, and I'm not a big fan of keeping you on it, those are usually ones that I will keep you on until you achieve that fertility goal, and I'm going to take you off of it.
Gotcha.
And one thing that I think we forgot to mention here is how long these medications impact.
That was my next question. Awesome. Please go for it.
So the sperm cycle is about 3 months. So anything you do to your testicle has an impact, or on your body at all, has an impact on your fertility for at least 3 months. So, I see guys all the time. I'm sure you see guys all the time. They're like, all right, I'm stopping my testosterone. Let's just repeat the semen analysis in like 2 weeks. I'm like, no, buddy.
Yeah.
If at best we got to wait 3 to 4 months, right? Because we're not going to see the impact of those medicines, whether it's, and there's other things, right? Hot tubs, saunas, steam room, jacuzzis, wet heat kills your sperm. Your balls are outside of your body for a reason, because they need to be a couple degrees cooler for your testicles to develop sperm in their ideal environment. That kind of stuff. Any other medications, smoking, marijuana, all these things can potential to some capacity impact your fertility. And if you want to see the results, you're going to have to wait at least 3 months.
And I think that's really important as a fertility specialist, because again, going back to the couple, if that woman is over 35, those 3 months could actually be really important. So the sooner we so I think the big takeaway here is just the education piece and understanding when you are going to seek out TRT, there's a role for it, there's a place for it, but working with someone who understands what your family building goals are. And number two, I think it's really taking into consideration the couple, because in all of this, you mentioned the 3 months. Sometimes it takes longer. Sometimes it's 6, sometimes it's 9. Back when we were talking about that 90% will get it back within a year, that's a year, that's 12 months. Yeah. And if she's 38 or 42, that's a really long time in the female reproductive space. So really, really important. I appreciate you saying that. You actually segued into my next question as we start to kind of wind down here. And I want to talk about some lifestyle stuff. And you mentioned things that can actually hurt: saunas, hot tubs. I actually had a construction worker who would come home so sore every night, he would get into the hot tub every single night. So then we did a semen analysis, and I was like, what the heck? So, tobacco, vaping, all of that kind of stuff is really important in terms of injury. But as a fertility specialist who really tries to focus on the whole person approach to fertility, really focusing on not just the medical aspect, but all of the adjuncts, the integrative medicine that we know of, what can you speak a little bit to that, please?
Yeah, so I want to kind of first go back to something that you had mentioned in the time frame of everything first, because I think the most important thing when we're talking about couples fertility is that we have to understand that everything we're talking about here is a two-way street. And there is an unfair stigma on the female partner about getting evaluated, right? So 50% of the time of all couples struggling with fertility issues, there is a male factor component. In fact, 30% of the time, it's strictly a male factor component with the couple's fertility. And often we have seen guys who, their partner has gone and seen you before. You've tried to get them in the door. They just won't come in. They won't get evaluated because there's this stigma and, fertility, masculinity, and manliness. I can't be infertile. It can't be me. And that delays that process, right? That is exactly what you were saying. That partner, you've been trying for 2 years. You didn't know testosterone causes fertility. Your partner went from 34 to 36, and now you have to stop testosterone for a year before you get sperm in your jacket. Now she's 37. That's a big difference. That's a big difference. So talking about these things and with your partner, whether you're a guy, whether you're a girl, whoever it is, as a couple, you should be saying, listen, we're going through this together. It takes two to have a child. It takes two to tango. I'm going to go to the doctor. You're going to go to the doctor. We're going to figure this out.
Correct.
So I just want
couldn't agree more. I always say infertility doesn't discriminate. It affects men and women equally. And so if there is a male partner involved at the time of evaluation, they get that semen analysis kit just like the woman gets her kit and her stuff. So absolutely. I love that.
So back to your other stuff with the lifestyle. There's so much BS out there right now. There's a lot of crap, a lot of awful advice online, on social media with regards to fertility care, to testosterone. The most important things, if you're interested in at least, optimizing your testosterone in general, natural ways, very easy. Weightlifting is actually the best exercise. Exercise in general is great. Weightlifting, resistance training is the best way to improve your testosterone levels. Getting good sleep is listen, we struggle with that, right? But getting good sleep, getting 8 hours of sleep is very important. Your testosterone levels, go in a circadian rhythm in your body. So it's very important. Your testosterone levels are highest in the morning, which is one of the reasons why morning sex people really enjoy. Fun fact. But that's important. Having a good diet, decreasing, processed foods, eating lots of vegetables, fruit, reducing all that can be very important. There's no specific diet with regards to testosterone. They've looked at low calorie diet. They've looked at, low fat diet. They've looked at Mediterranean diet, and they've all pretty much been equal. I think the idea is just eating healthy in general is going to do that. Weight loss is going to help improve your testosterone levels.
Can you just touch on the why there?
What?
Can you just touch on the why there for weight loss?
Well, weight loss for several reasons. One, we know that it impacts the availability of testosterone in your body. It impacts, physiology-wise, there's something called SHBG, your free T, total T. These things are all compromised. I explained before that theoretically, right, your fat converts testosterone to estrogen. So the more fat you have, the more of that testosterone is going to be converted to estrogen. So, losing weight also gives you the energy, the ability to move better, so it's a compounding factor. Lifestyle things like smoking cigarettes definitely causes fertility issues. Vaping, the data is loosely associated, but it's I always tell people vaping, there's some data suggesting any tobacco product. Unfortunately, people like Zins and stuff like that in their mouth, those things can also potentially compromise. Marijuana, it's a hard one because, as we know, it's becoming more legalized and more readily used. I usually don't have a problem with my patients smoking weed unless, they're really trying for fertility. And at that point, if we're talking about doing everything we can to make sure that your semen parameters are the best that they can be, I say, limit to cut off for smoking marijuana or ingesting marijuana in any way, because I don't know what the threshold is. I don't know whether 10 milligram edibles versus five, like a joint versus, I don't know, and we don't have that kind of data. So I think that at best, just kind of eliminate it if you can. The other thing we talked about: hot tub, sauna, steam room, jacuzzis, always important. You're pretty much cooking your testicles, so that's something that you do want to avoid. Impacts it for 3 months. People ask about cold plunges. I'm not completely sure. There's no real data on it, but I tell my patients to avoid it as well, just because I feel like extremes of any temperature probably not good for the body. And I think you would agree with
now, on the female side, we talk about things like acupuncture, fertility supplements, as you know, is a multi-billion-dollar industry. On the male side, is there any like yay, nay, meh? What are your thoughts there?
Counsel my patients in terms of supplements. I say, listen, the data is not great. There's been a couple of studies showing that it does work. Some say it doesn't. The strongest studies that have come out for it really suggest that there's no true benefit. But then again, I tell my patients, I say, listen, the biggest risk of taking these medications is the risk to your wallet. They're not cheap. They're not always cheap. But if you're interested in taking it, I welcome you to take it. It's not gonna hurt you, I don't think.
Gotcha.
So, things I do recommend, I say daily multivitamin, coenzyme Q10, and vitamin C esterase. But once again, that's more of an optional thing. I have no problem if you're taking it. The acupuncture thing, I'm not against acupuncture. I'm very, very for acupuncture in many, many things. I'm not too familiar with the literature for men and acupuncture, but I'm for that. I do believe in acupuncture as a treatment for many things. So if it's something that you wanted to be interested in and you wanted to explore, I do welcome that. I don't think it's going to be harmful really in any capacity.
And I do concur on the female side. I think, we're slowly in Western medicine starting to see more and more as it relates to kind of some of those integrative practices. So as long as the patient doesn't have needle phobias, it's definitely something that I'm recommending. And it kind of falls into that same category of the supplements. Those studies are hard to do, in terms of methodology and treatment. The one takeaway I do tell everyone, and this goes back to the timing that Dr. Dubin was mentioning earlier in our discussion, is that anytime, both male and female, if you're going to talk about supplements, acupuncture, any of those interventions, you really want to give yourself a minimum of 3 months. Most of the studies are looking at a minimum of 3 months, if not longer. And so you really want to take that into account as you're navigating your journey. And then the other thing I'll just add is that for a long time, I think there was very much a concept of either or. So you were either going the holistic approach, natural approach, or you were going the medical, Western, traditional approach, etc. And I would just offer that they're not mutually exclusive. I think, if anything, the goal of both Dr. Dubin and myself is to optimize the patient's fertility journey. And if acupuncture and supplements, relatively low cost, low side effect profile, etc., why not? Why not incorporate it into the journey? So I think we're pretty aligned in that regard.
I wanted to ask you a question: how you counsel your patients with regards to EDCs, endocrine disrupting chemicals, because I think that has become a very hot topic and an important one. I'm a big fan of Dr. Swan, who she wrote a book, if you're interested, The Countdown, discussing about decline in fertility in at least in men. And she is a big EDC person. So do you counsel your patients with regards to
So the short answer is yes and no. And the reason I say it that way is because I also am a firm believer in that life still has to happen. As you very well know, infertility is a marathon. And most people are with us for many months, if not years, as we've been, the timelines we've been talking about today. And so, yes, it's important. And if there are small practical changes that are not going to be ultra restrictive or really significantly impact quality of life, then I'm all for it. So we do talk about those things. We actually have, on the female side, there's a really nice list of companies that use organic materials for like their makeup, for their home detergents, things like that. So those types of things we do chat about, but I also don't want it to reach a level where it's completely taken over the couple's entire life.
I think that's an excellent point. I think that there's a level of fear that you shouldn't have, but there are some things that, people come in and they ask about realistic ways in which they can change that. And, there are an insane amount of plastics in our daily lives. If you want to change to glass things, if you want to get less scented, shampoos and things like that, I always recommend those kinds of easy, quick fixes. But yes, should it be controlling every aspect of your life? No, I don't think so. But, if we're talking about optimizing these things, I do often bring that up. The final thing that I didn't bring up that I think is very important is the proper lubrication. Beautiful. Because we do know that certain lubes, in fact, most lube for sex, actually can compromise your sperm. It can kill your sperm. The one that I usually recommend, and I'm not paid by them, although if they want to, I'm happy to take a sponsorship, is pre-seed. So pre-seed is one that we know there's data suggesting and confirming that it does preserve your fertility. It doesn't kill the sperm. And that's one that, that's a quick little hitter or quick tip that I think is very helpful for a lot of our patients.
I love that. Thank you so much. That was a great point. So we covered a lot today. This talk is actually going to live here on my account and eventually make itself over to my YouTube channel. But I wanted to ask you, like, one final takeaway of all the things that we talked about. If people are like, one salient point that I want to remember from tonight, what would you say that is?
I would say that the biggest point is that testosterone causes infertility. Taking testosterone causes infertility. It will likely kill your sperm and can potentially compromise your ability or delay your ability to have children in the future. And before doing that, make sure you understand what your goals are at the time. Make sure you talk to a local healthcare provider. And all of that being said, if you're interested in fertility or going through it with your partner, and this is mostly for guys, make sure you go get worked up. Go talk about your health with someone, because sexual health, fertility health is often a sign of other health problems. Mm-hmm. Infertility is associated with diabetes, high blood pressure, obesity, low testosterone, history of cancer. These are all things we already know. And so it's a good marker often of people's health. And I can't tell you how many times I've seen guys who have come to my office, haven't been to a doctor in 30 years. They say that they're healthy. They're 40 pounds overweight, and I diagnosed them with diabetes. So, so it's important.
And myself, as a female fertility specialist, have also diagnosed diabetes from an abnormal semen analysis. So I send them for the hormones before I send them to you, and voila. So Dr. Dubin, this has been fantastic. I know you mentioned you're part of the Memorial Health System, but could you also just tell us how people can find you online, how they can work with you? You didn't mention this in your intro, but you actually also have a podcast as well. Can you just share some of that info with the audience?
Absolutely, Dr. Swallow. Thank you so much for having me. This was amazing. This was really fun. We should definitely do this again. For sure. You can find me at, Google my name, Justin Dubin. I'm on Instagram right now at Justin Dubin MD. I'm on TikTok, Instagram, Twitter. My podcast is The Man Up Pod. We're on YouTube at The Man Up Pod, on TikTok, Instagram, Twitter, and our YouTube channel as well. We're on Spotify, iTunes, and this is what we do. We talk about men's health issues. We try to destigmatize the conversations and educate it with me and my friend who is also a urologist and men's health specialist in LA. So, we bring on guests. We talk about men's health issues. We actually, this week's episode is all about Clomid and HCG and optimizing your testosterone for fertility. So go check that episode out. And thank you so much, Dr. Swaldo, for having me.
Yeah, absolutely. This was so fun. Thank you so much. Have a great night. Thanks, everybody.
And also, I want you to share this. I want to collab on this on my thing.
Absolutely. All right. I'll talk to you soon. Bye-bye now. Bye-bye.